Several learning communication and behavioral difficulties. Learning difficulties are a generic term that refers to a heterogeneous group of disorders manifested by significant difficulties in the acquisition and use of the ability to understand, speak, read, write, reason, or for mathematics. Some causes of these difficulties are physical trauma, the environment in which they grew up, physiological trauma, risks during pregnancy. These difficulties can be noted by delays in language development, delay in understanding basic concepts, and memory deficits. This is divided into several fields, such as language, reading, and arithmetic, among others. For IT, there is no specific treatment. These are the possible ones: therapy, complementary and alternative medicines, extra help in the activities that are difficult, adaptations in the classroom. While communication difficulties occur only in language, covering speech, writing, and reading, they are alterations that affect one or several components of language without causing sensory, cognitive, or motor deficits affecting only language. This has some implications for education, since all communication disorders have the potential to isolate individuals from their social and educational surroundings. It's essential to find a fair and appropriate intervention and specific treatment for communication disorder is decided by your child health care provider, special education teachers, and speech language and mental health professionals. Finally, severe behavioral difficulties are caused only with family environment and with the child development. I feel this is a behavior disorder characterized by antisocial behaviors that violate the rights of others and age-appropriate social standards and rules. This might include irresponsibility, delinquent behaviors, violating the rights of others, such as theft or physical aggression against animals or others. The condition that contribute to development of conduct disorder are considered to be multifactorial, meaning that many factors contribute to the cause. It is divided into three: aggression, impulsivity, and hyperactivity. Aggressiveness is an emotional state that consists of feeling of hate and desire to harm another person, animal, or object, to pretend to hurt someone physically or physiologically. Impulsivity, on the hand, is the rapid, unexpected, and excessive reaction to any situation. It is a condition where the person cannot control the impulses, temperation, or desires that he or she feels. Finally, hyperactivity or attention deficit hyperactivity disorder is a neurodevelopment mental disorder that is a diagnosed by psychiatrists or clinical psychologists. In the diagnostic process, it is very important to have a neuropsychologist as well. A specific treatment for children with conduct disorder will be determined by your child physician based on A. Medical history, exam or symptoms, patent tolerance treatments, might be family or group therapy, cognitive behavioral approach, and controlled medication.